Record numbers of infections and deaths sweep Nepal, prompting fears its second wave may be worse than India's. The Sukraraj Tropical and Infectious Disease Hospital in Kathmandu is packed. Health experts and frontline medical workers have described the situation as near-apocalyptic, as they face shortages of hospital beds and oxygen. With just over 21,000 tests on May 19, Nepal logged 8,173 COVID cases and 246 deaths, the highest number recorded since the pandemic broke out last year. Health experts believe the real numbers could be much higher as testing remains low. More than 5,600 people have died since the pandemic began, nearly 2,000 in the past few weeks alone. The pandemic has particularly affected the Kathmandu Valley and the country's western lowland bordering the Indian state of Uttar Pradesh. The region is one of Nepal's least developed, with a large concentration of indigenous people and ethnic and religious minorities. Most hospitals, except for the large ones in cities, do not have a machine for polymerase chain reaction (PCR) tests. The rising number of cases in the country has set alarm bells ringing. Experts have linked the spike in Nepal to the devastating second wave in its northern neighbor, India. Up to mid-April, deaths from COVID had been confined to single digits. At 6.51, Nepal's daily rate of deaths per million is now the worst in South Asia. The shortage of beds is a common problem across Nepal, which has approximately 18,900 general, 1,450 ICU and 630 ventilator beds across the country. New Delhi, India's capital with a smaller population, has more than 4,000 ICU beds. Nepal's number of doctors per capita is also one of the lowest in the world, with 0.17 doctors per 1,000 people, while India has 1.34 doctors per 1,000 population. At least 12 ICU patients have lost their lives due to oxygen shortages since last week, according to media reports. In recent weeks, medical aid, including oxygen tanks, has been trickling in from across the globe, but officials say that it is nowhere near enough to meet demand. Many Nepalese living abroad have pitched in. Nearly one-third of Nepalese work abroad. On Wednesday, the Ministry of Health and Population confirmed it had detected a third COVID variant in the country, B.1.617.2, a variant first detected in India which is considered highly contagious. The new variant was detected in 97% of the samples collected from 35 districts in the country. The other two variants are B.1.617.1 and B.1.1.7. Health experts in Nepal had warned in March about the danger of a more lethal variant of the coronavirus entering via India. The warning was not unwarranted. Millions of Nepalese work in Indian cities such as Delhi and Mumbai, and many started to return in April as several Indian states imposed lockdowns in the wake of the country's devastating second COVID wave. At the same time, the Prime Minister continues to recommend unproven herbal medicines, going as far to say that Nepalese have better immunity to withstand the virus. Nepal, a poor country of 30 million, has vaccinated barely 2 million people, mainly frontline workers, since it started inoculations on January 27. So far, the country has procured more than 3 million vaccines, including 800,000 doses from China and 348,000 doses from the WHO-led COVAX facility. Defending the government's handling of the COVID situation, former Minister Mani Chandra Thapa told Al Jazeera,